I am going to have you guys break up into groups of 4. So it's really just going to be the people, like you will be a group of 4, you'll be a group of 4. There will be one group of maybe 5. It might not work out totally fine, and that's okay. So this activity is called Pass the Chart. So you guys will be a team. That's your chart. You guys are a team. 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 And then all of you guys are going to be a team too. So what is this game? This game is kind of like a rapid concept review. You guys were awesome, and from the entry ticket, I know a lot of you prepared. So the topics that I lectured on last week and I posted were health assessment, health supervision, and atraumatic care. So what we're going to be doing is, as a group, reviewing those concepts. So we're going to start with health assessment. On the screen, you guys are going to see a question, and most questions have 4 answers, which is great because there's 4 people in a group. After the question comes up, you guys are going to, one individual is going to write their answer and then pass it to someone else. That next person is also going to write an answer and pass it to someone else. Ideally, it's not the same answer. It's all a different answer. All of these questions have multiple answers, so it's not supposed to be like too tricky or anything like that. You have access to your notes if you want to use them. There are things called rapid fire questions. You'll see them on there. That's when one person, it's just kind of random, one person answers all 3 questions. This is just for fun. It's just for review. It is a lot of fun. There's candy. There's candy. After we go through the question, I will pick one group. We'll talk about your answers, and then we'll also look at like the correct answers. Okay? So what I first want you guys to do is, you will see that I have in your charts color-coded the number of questions on different pieces of paper. So health assessment is the purple piece of paper. So go ahead, write a group name. So come up with some good group names. I'm interested to see what you guys come up with. And then write your individual names on there too. All right, are we ready to start? All right, here we go. Question number 1. What are the components of health assessment? 20 seconds. Ten more seconds. I'll give you some more time. 5 more seconds. All right, that's time. I'd like to hear from Josh's group. I didn't catch your name.
Oh, we're the Happers.
The Happers?
Yeah.
Happer? What's a happer?
Heifer.
Heifer. Like a cow.
Yeah.
Got it. All right, Heifer. I'm not going to call. I'm sorry. I can't do it. I can't call you that. No. Okay. What are the components of health assessment?
Health history.
Okay.
Physical assessment.
Okay. 2 more, if you got them.
We put vital signs, but I don't really think that's a part of it.
Okay. Well, that would go with physical assessment.
Yeah.
Give me one more. All right, let's review. That is correct. So we have the health interview and health history. That's where we do a health interview, obviously. We're going to ask the patient certain things. We're also going to ask the caregiver about why they're here today. We're also observing the parent-child interaction. That can clue us into family dynamics and if there might be an issue with psychosocial needs. Assessment of the child's emotional, physiologic, social, and cognitive development. That all makes sense, right? And then last is our physical assessment. Why are we doing the physical assessment last? It's invasive. And all of this is going to help you focus your health assessment. If you don't know why they're there and you just assess and you don't know what's going on, it's not going to be as a complete health assessment as you could have had. Good job. Next question. Name techniques to enhance therapeutic communication. Ten more seconds. 3 more seconds. All right, Fab 5, tell me what you got.
We got eliminate barrier.
Okay.
Use open-ended questions.
Okay.
If they're appropriate reading level.
Absolutely.
And active listening.
Great. How do I actively listen to someone?
Eye contact.
Eye contact. I come right over here to, what's your group name?
Yes.
What is it?
Yes.
Yes.
They named their group Yes, so I'll come over to Yes. Let's have a conversation.
Oh, man.
Sorry to put you on the spot. I'm at their level. I'm engaging with them. I'm letting them talk. I'm not interrupting, which is hard for if you're like me and you love to interrupt people. Why do we like open-ended questions? It allows them to talk. That's correct. Allowing someone to talk is going to get you a lot more answers if they are the ones directing the conversation. You also have to know what kinds of questions to ask, but we'll get to that later. Next question. What are some components of the health history? Five more seconds. All right, 7 more seconds. All right, what's your group name?
Group number 1.
I thought they were group number 1.
No,
Sorry, you're group number 1 and you're the survivors. Got it. Okay. Tell me some components of health history.
History of present illness,
Okay.
demographics,
Yes.
review of systems,
Yes.
family history.
Excellent. What's an example of a disease process that might have some strong family history? Diabetes. What else? Cardiac. Lots of cardiac stuff. We'll also be talking about this later. Pyloric stenosis, that's a GI issue. That tends to run in families. It's not uncommon for it to. Excellent. We also want to review birth history. Why do I care about the birth history? Premature. What does that mean? What kind of outcomes is a premature child going to have?
Delayed.
Developmental delays.
Which technically isn't a delay if they're premature.
That's correct. It's not technically a delay if they're premature if we are correct in doing our chronologic age. That is correct. Good job. Next question. What are the nursing considerations when assessing an infant? A lot. That's a good answer. 10 more seconds. All right, Enema of the State. Ugh. Great album, terrible group name.
Allow caregiver to hold/participate, least invasive to most invasive, auscultate heart, lungs, and abdomen while newborn is quiet.
Excellent. What's an example of a least invasive nursing assessment?
Counting respirations.
Counting respirations. Where can I count them?
Bedside.
I can count them at the bedside. If I got a really good eye, I can count them from over here before I even get too close, depending on how the child is positioned and what I can see. Make sure it's accurate, of course. Why do I want the caregiver to be involved? Less traumatizing. They know their child. The child will be more comfortable. Excellent. We're also going to count the respiratory rate when the child is calm and keep them dressed. If we undress them before we need to, they're going to get cold. When they get cold, they get stressed. I know if a baby is cold because they have a lacy, if they're brand new babies, they get like a lacy mottling on them. And it goes away once you wrap them back up. But they'll get real irritated and start crying, which will not help your assessment. Question number 5. How can the nurse involve toddlers and preschoolers during a health assessment? All right, group number 1, what you got?
Incorporate play into the assessment.
Okay, incorporate play,
Include family.
include the family.
Show on dolls.
Yes, demonstrate on a doll before you attempt the procedure on the child. Good.
And the child may have fear of the bodily invasion procedures, so let's be aware of that.
Yes, and the child might be afraid of bodily invasion, especially in this age group, so that is something to be aware of. Can I practice blood pressure on a doll? Yeah. Can I practice an IV start on a doll? Yeah, why not? You're not going to leave the IV in the doll, but you can demonstrate it on the doll, absolutely. I wouldn't necessarily recommend doing it on their most favorite doll or actually doing it, but you can pretend and involve the child in that. Giving them a task to complete during the assessment will make your life a lot easier. And it doesn't have to be a big task. It can be, show me how you play your game. That's how we can assess the neuro status of a preschooler. Show me how you play hopscotch. Show me how you play on your iPad, right? Good job, guys. What are the steps for physical examination, excluding abdominal assessment? 30 seconds. Ten more seconds. All right. Yes. That's you guys. Tell me what you got.
Observation, palpation, percussion, auscultation.
Observation, palpation, percussion, auscultation. No, definitely in that order. That's what we want. Because if we percuss before we palpate or do it in the wrong order, that can alter our findings. That's a pretty straightforward question. It's probably bringing you back to health assessment. You guys might not want to stay there. I understand. Question number 7. What are some pediatric considerations when assessing vital signs? Five more seconds. All right, Fab 5, tell me what you got. Whoops. Least invasive to most invasive. Good.
Axillary temperature.
Yes.
Vital signs according to age.
Yes.
MVP on lower leg if they're a toddler or infant.
Yes. Why do we do least invasive vital signs before we do most invasive vital signs? So they don't get worked up. If you work up, I'm sorry? Also, we build trust. Good. If we work up a child, that will falsely elevate their pulse, their respiratory rate, and their blood pressure. What is an example of an invasive vital sign that we measure? Blood pressure. One more. Temperature. Depending on the age of the child, will do temperature last or I'll do blood pressure last. Both of those are very invasive and it doesn't hurt, it's just uncomfortable. But babies hate getting their temperature taken under their arm. Why don't we take temperature in their mouth? It doesn't work. Their mouth is very small and they can't follow direction to keep it under their tongue. That's why we do it under their arm. Another option would be taking a rectal temperature, which we do in the ED. That's what they'll do for like every child. But on the PEDS unit, we need an order from a provider to do a rectal temp. Why do we do blood pressure on their leg? Most kids are really chubby with their arms. They're also chubby on their legs. But with babies, they usually curl their arms up. And it's much easier to stabilize their lower extremity and get a better reading. Also, the vasculature is a little different, and it won't take you quite as many attempts if you do it on the lower leg. Good. Count respiratory rate prior to touching the child. But yeah, excellent. Question 8, rapid fire. One person from your group is going to answer all questions, so go ahead and pick a lucky number. You don't get to know the question, you just get to... Is everyone ready? All right, here we go. When does the posterior fontanelle close? When does the anterior fontanelle close? And how long do we measure head circumference? Five more seconds. All right, Josh, Savannah, Abby, and Peyton. I'm sorry, I cannot keep calling you by your group name, please. I'm not doing it. You tricked me. I fell for it. All right, tell us the answers to these questions.
4 to 8 weeks.
For posterior fontanelle.
Yeah.
Anterior fontanelle.
12 to 18 months.
Okay, that's correct. And head circumference, how long do we measure?
So 2 years.
2 years. Again, posterior fontanelle closes by 8 weeks of age. Anterior fontanelle closes between 12 and 18 months. And how long do you measure head circumference? Up to 2 years. You guys will have that in your head, I think, probably forever, because we talk about it all the time. Number 9, list common integumentary assessment findings in a newborn. Yes, I apologize. This is where we're doing it just like normal. 7 more seconds. All right, you said survivors, right?
Yeah.
All right, tell me what you got.
Acrocyanosis.
Acrocyanosis.
Modeling.
Modeling.
Dark pigmentation.
Dark pigmentation.
Rashes.
Rashes. And, oh yeah, sorry, I have a long list. Sorry, yes, that's great. Okay. Yes, those are moles. What's acrocyanosis? Blue hands, blue feet. Is it cyanosis? Not when it's on your hands and your feet and you're a newborn. That gets a different name called acrocyanosis. Modeling. I don't know if it is adult, it's usually just modeling, like it's near death. So like feet will model, and usually hands don't turn blue in adults unless it's like Raynaud's or something like that. At least I hope not. We talked a little bit about modeling, lacy modeling. If the baby is cold, that's normal. Right after a baby is born, the color that they usually are considered in Caucasian babies, ruddy and mottled. That's like red and kind of like all over the place, like they have some modeling to them as well. What's a Mongolian spot?
They kind of look like bruises.
They do kind of look like bruises. Are they bruises? No. Does that mean someone's beating their child?
They normally go away.
No. Sorry, what was it?
I said, and they normally go away.
They do normally go away. Sorry, I was answering survivors' questions up here. So yes, they normally go away with age. Good. A lot of new nurses will see Mongolian spots on babies of color, and they don't know what they are. They look like bruises. People think that they're spanking their babies. That's not it. It's a normal assessment finding. Lenugo. Does anyone know what Lenugo is? It's like this really fine hair. It is usually in premature infants. It can be in term infants, just not as common. And it keeps the baby warm in utero, and then it just falls out later. Question 10. What does a nurse consider when assessing the integument? Five more seconds. Fab 5, tell me what you got.
Temperature, moisture, texture, turgor, and edema.
Temperature, moisture, texture, turgor, edema. What is turgor? Pinch it and it goes, yes, you want rapid recoil. Where can we assess skin turgor on an infant? You could do their hands. Their chest is the best place, because their hands, depending on how old they are, might not have as much tissue to grab onto. Yes. Temperature. Is it normal to have cool extremities?
No.
Some people, it's not abnormal. It doesn't necessarily indicate something's wrong, but typically we are looking for warm core body temps. So I will say if one foot is cold, let's hope the other foot's also cold. It's probably just their normal. They just have cold feet. Bonus question. What body system has a significant impact on skin's texture? From group number 1, I think I heard cardiac. Can you expand on that? Cardiovascular. Okay, go ahead and expand if you want. Capillaries are close to the surface. Good. What else affects the texture of the skin? Hormones? Teenagers have oily skin because of hormones. That can affect the texture. So the endocrine system actually has a significant impact on the nature of, like, the health of the skin. So individuals who have endocrine disorders will oftentimes have skin that's very dry or flaky or oily or just a little out of the normal. Does that make sense? Also cardiovascular, Kelsey, which I appreciate. If it's poorly perfused, or we might have some issues with arterial or venous perfusion. Question number 11. What does PERLA stand for? Sounds like everyone got that. Pupils are equal, round, and reactive delight. And accommodation. What's accommodation?
Focusing on something near.
Focusing on something near. Good job. Another rapid fire. I know. Pick one person in your group to answer the question. You guys ready? How do we assess the ears of an infant or toddler under 3? How do we assess the ears of a child over 3? And during what point of the health assessment do we assess the child's ears?
So number 2.
5 more seconds. The yes team. Go ahead and tell us your answers, yes team.
Under 3 is like this.
Under 3 is down and back. And then over 3 is up and back. And when do we assess ears? In the course of the health assessment. Towards the end. It should be the last thing we do. Why? It is very invasive and it's uncomfortable. Typically, in my practice, nurses do not look in ears because there's not a real need to. We will see that more in the clinic when a provider is doing a head to toe or an initial assessment made by the provider upon admission. But nurses, in my practice, we don't do that. Another rapid fire. Pick someone else in your group. You guys pick somebody? All right. Sorry, I'm making sure the volume's turned off. We are going to ask, what is the respiratory rate if this breathing effort is labored and if this breathing pattern is normal for age? Oh, it's a video. This is my sweet nephew. This is 1 minute long, so I'd start counting. He couldn't make it too easy, could he? He's dreaming of all his milk. He's having milk coma dreams. Aw, little smile. Okay, you guys want to watch it again? Let's talk about it. So we have abdominal breathing here. This is irregular breathing. They don't breathe normally in the normal, they don't breathe in a normal pattern. He's scooting around, so that makes it kind of confusing, or like you might lose your count. Just getting comfortable. And then he's back at it. We don't see any nasal flaring. We're just seeing some belly breathing and just a little bit of pulling up there. Just a little bit. Probably because his neck is like this. In my opinion, this would not be labored breathing because he is a newborn. This is newborn breathing. Now, if he was nasal flaring and having supraclavicular and pulling, like tracheal pulling or tracheal tugging, that would be different. I think it's just the way that my sister has him lying down. He might be a little more extended. Anyone catch a respiratory rate on him?
58.
Yeah, it's right around 58 to 60, depending on how you when you start counting and how you count through the actual the wiggles he has.